I'm Chika Onwuvuche, Program Officer at the Washington Area Women's Foundation, and I'd like to welcome each of you to Ask Her, addressing our Black maternal health crisis. For those of you joining us for the first time, the Women's Foundation is a community-supported organization that invests in the power of women and girls of color in the Washington, D.C. region. Through our commitment to grant making and advocacy, we drive transformative change by amplifying the voices and experiences of women and girls of color and collaborate with partners to influence policies and philanthropy with a focus on gender and racial equity. Black women in the United States face a maternal mortality rate nearly 3 times higher than their white counterparts. Despite medical progress, racial disparities persist, with Black women often marginalized by healthcare providers. Today's webinar will spotlight the importance of personalized, supportive healthcare approaches that can positively impact the lives of Black women, empowering them with informed decision-making and comprehensive care throughout their maternal journey. We invite you to engage in today's discussion by asking questions in the Q&A box and sharing your thoughts in the chat. If you find today's conversation meaningful, please consider supporting our birth equity work by making a donation at thewomensfoundation.org/askher. Your contribution will play a vital role in addressing the maternal health crisis in our region and ensuring equitable access to maternal health care for all individuals giving birth. Thank you again for joining us. And at this time, I would like to pass the mic over to our moderator for today, Dr. Tamara Wilds-Lawson, President and CEO of the Women's Foundation.
Thanks so much, Chika. We are very grateful to be in this space today with all of you, highlighting 2 experts who we're going to have an opportunity to chat with shortly. We were supposed to be joined by a third, Dr. Lightfoot, but she is where she's supposed to be, which is with a patient who is giving birth at this exact moment. So I am going to share a little bit of information about Jade and Melody, and also include Dr. Lightfoot in that. We hope that she will join us, but as I said, she is where she's supposed to be. So here is a little bit, and I mean just a little bit, about Jade Hillary and what she has accomplished. She's a passionate sexual and reproductive health and justice advocate that dedicates her time to supporting people through her roles as a full spectrum doula, a birth educator, trainer, facilitator, and sensual and erotic movement instructor. Jade has a background in public health and was inspired to become a doula because of her time as a sex educator working with young people in different communities in the US and abroad. She believes that everyone deserves compassion, education, and support across the spectrum of pregnancy-related outcomes. Welcome, Jade. And Dr. Lynn Lightfoot, who may or may not be able to join us, has been with Foxhall OBGYN since 2005 and is board certified by the American College of Obstetrics and Gynecology. Dr. Lightfoot's practice encompasses the full spectrum of obstetrics and gynecology, and her goal is to provide personalized care from adolescence, fertility, pregnancy, menopause, and beyond. Dr. Lightfoot has consistently been named as one of Washington's best doctors, Washingtonians' best doctors. A native Washingtonian, Dr. Lightfoot also has the distinction of being the first Foxhall doctor who was actually delivered by Foxhall OBGYN. And so again, we hope she'll join us later. And finally, Melody Webb is the executive director of Mothers Outreach, an advocacy organization that promotes the inclusion and empowerment of Black mothers in the struggle for family preservation by transforming government income and child welfare family regulation laws, policies, and practices. Having spent her career practicing public interest law, her advocacy on behalf of and with marginalized communities seeks to reimagine broken systems. Recently appointed to the American Bar Association's Parents Attorneys Committee, Melody has lectured on the intersection between movement lawyering and family law and authored public policy articles. Welcome, Melody. Thank you all both for being here with us today. Are you ready to get started? So I want to make sure you both unmute so you don't do what I do multiple times every day with our team at the Women's Foundation, which is just talk away and nobody can hear a thing you're saying. I do want to I want to let the folks who have joined us today know that the Women's Foundation wanted to be intentional in our conversation and highlight the data points and statistics, some of which Chika named in her introduction of the topic, and hold even more space for the work that is being done and for the ways in which individuals and organizations, community-based organizations, and other entities are addressing the crisis, right? It is really easy, particularly as Black women, to be mired in a conversation that really foregrounds the devastating data points, and it's critical for everybody to be informed about that. But we wanted again to make sure we made time and had time in this conversation to educate folks about what's happening and give folks information to help them understand what they can do and contribute, which are questions we know, Melody and Jade, you probably get often. So let's get into it. Let's start with you, Jade. With your diverse background in sexual and reproductive health education and your roles as a doula, birth educator, and facilitator, could you share with us what initially inspired you to start this journey?
Yeah, absolutely. So in my bio, you referenced like I would say the two final moments that like rang the bell of, girl, you need to be doing this. And those were my time in Peace Corps as a community health promotion volunteer and coming back to the States, deciding during the Peace Corps that I wanted to do sex ed, I wanted to do public health and quickly realizing I'm not sure what that means, but I need to figure it out and make it happen. But then moving back to the States and being a health educator and working with lots of students across San Diego, um, but had a group of pregnant and parenting youth that I worked with. And so I would say like that was again the final thing that was like, Jade, there's something here. You need to use whatever skills, tools, talents, abilities you got to figure this out. And so with those two kind of key final moments out of what I would say are like 7 key moments in my personal timeline, and I can go into that if you'd like me to, but with those things, it was, learning about the culture of birth in Peru, learning about what a postpartum house visit looked like, learning about how it is a community event when somebody gives birth. And even, what they call giving birth is to dar la luz, to give the light, and that being so beautiful. Um, and then, like I said, that being a spark of public health SRH moving back here. And so with my students, with my young people, doing all the typical sex ed things like condoms on bananas and let's talk about HIV and like all these really fun things. But then also, within those groups, having the specific groups of pregnant or already parenting young folks and gaining the trust, building that rapport so that I was privileged enough to hear their stories of how they had given birth in the hospitals and what that was like for them, or, what they were afraid of because what they had been hearing. And most of my students being young Black and brown folks, and, you know, them being part of mixed status families or their family members, having language barriers, so they also can't support advocacy. And there was very little birth education that was happening. So folks didn't know their options, like hearing all of these things. And just some of the components of the stories, some of them were beautiful. They found their moments, they had their joy. And then a lot of the stories, they talked about things that were just sometimes downright cruel in terms of the treatment that they faced, the treatment that them and their families faced when they were going into certain systems. And like I said, that was like the final piece of the puzzle that was like, Jade, you got to, what, I don't know what to do. I don't know what this is called. And then realizing it's called being a doula. It's called being a doula. I keep toying with the idea of maybe I'll become a provider one day. Maybe I'll put a midwifery hat on top of everything else that I'm doing. But for now, stepping into this space and supporting people in knowing their options, having the education, being able to do the research, knowing what their resources are, um, and how they can take care of their whole selves and their families, and doing it in the space that I'm doing it in, that is, why I'm here today.
I have a follow-up question, and well, I'll start with well, actually two.
Mhm.
I think the rise in awareness about the services doulas provide, it
Mhm.
feels like there's been almost like an explosion and right
Yeah.
in recent years. I'm not sure everybody understands what it really means to be a
Yeah.
doula. Like in my mind, I think about it as someone who was a comprehensive advocate
Mhm.
for a birthing person. But as the expert here in this space, can you say a little bit about like the core things um, that being a doula consists of? And then the other follow-up question is, what are some of what are some of the main ways as a doula that you support Black women in advocating for themselves during their maternal journey?
Yeah. So the way I have lovingly come to put like quickly define what being a doula is, I am the auntie that knows a whole lot about birth. And so for a lot of families, especially back in the day, there would always be that one auntie or the one matriarch that knew a lot about very specific things. Sometimes, reproductive events was one of them. I step into that role. So I'm the auntie that talks about sex. I'm the auntie that talks about birth. I'm the auntie that talks about postpartum. And usually auntie will come ready with treats, with tips and tools and resources. I've always got a guy, and if I don't got a guy, I know a guy who knows a guy. So, being that connector in certain spaces, but, um, another way to define it is like as a doula, I am there for the emotional support. So I'm there to hold your hand. I'm there to, talk with you through things. And I'm not necessarily always coming with answers, because I really believe in, creating the space so that you can tap into what your answers might be, how you would like to move forward, or even what your power is. So I'm creating the space for that, whether it's prenatally, during birth or even postpartum or any other reproductive event that I'm supporting, because I am full spectrum. I'm there for information support. So again, sometimes I got a guy who knows a guy. And if I don't, then I, have some good resources on where to find information, but I'm also supporting you and asking questions so you can gather your own intel. Um, I am there for advocacy support. So sometimes that does look like stepping up, stepping in and amplifying what my client has shared. Even in the moment of, labor and birth, if something's going on and my client is, saying something to me on the side, I'm then amplifying her voice in the space. And then sometimes it looks like supporting you and identifying what questions you have, creating those pause points as everything is swirling around so we can get your questions answered. But, opening up the floor for you to be able to do that. So I'm helping you advocate for yourself. And then, sometimes a doula looks like providing the physical support. So again, I'm there to hold your hand. I'm there to do the double hip squeezes. I'm there to walk with you if that's what it looks like to support as you're going through the 9 months leading up to baby, or even, we're doing squats, lunges, we're twerking out a baby, whatever it looks like. I'm also there to provide the physical support. So a lot of different things. And for each client, it is very personalized. Sometimes my clients, I've had situations where my clients, um, I was a volunteer doula at one point in time, and they just wanted me there. They just wanted another person in the room to be there, just in case they had something that they wanted to talk about, or just in case they needed somebody to hold their hand. And then other clients have been very more involved, and they hired me from like 5 or 6 weeks of pregnancy, and we're still rocking together till this day, because postpartum is forever. So it looks a little different for everyone, but those basic four things: the education, the emotions, the advocacy, and the physical part, that is like the core four concepts of being a doula.
Thank you for that. I appreciate it. And it was also really helpful to hear that last piece, which is the personalized care, right? Which is probably often understated.
Mhm.
The value in having someone who was dedicated. I mean, how often as women do we really have that?
Right.
Right. And if there was ever a time when it would be helpful, deciding to bring a life into the world is that time. Melody, as the executive director of Mothers Outreach Network, how do you see the intersection between perinatal health, some of which Jade just talked about, and your organization's mission of promoting the inclusion and empowerment of Black moms in family preservation efforts?
Yeah, thank you. Thank you so much. And it's just so great to be in the space. And I loved hearing Jade's description of what she does. So just very succinctly, the struggle for perinatal health justice and the struggle for family preservation is innately centered around Black women, I believe. And that's because Black women are disproportionately impacted by the social and economic violence of both national crises that we have, that were previewed at the beginning of the program. And there's another intersection. Black women, mothers, and birthing people are historically involved and disproportionately expert in these issues, and should lead the movement for transformative justice in both spaces. And I would say that Black women, have led struggles for civil rights and economic justice historically. We know the names: Fannie Lou Hamer, Ruby Duncan, Johnny Tillman. And with that premise, and this is where I see the intersection again, they should lead in these twin spaces of maternal health and family preservation. And this is what our organization is trying to foster. There are leaders in the space of family preservation, and out of New York, Joyce McMillan, and we have Maria Jackson here in DC. And so we work to build power and collective strength. And we believe that it can make improvements in maternal health outcomes. And so we're a DC-based group, and we use power building at its core to transform. Our focus, again, is government income and family law policies and practices. And we engage in organizing, representation, education, and advocacy. And I would, if I could for a moment, just give a little bit of background by what we mean about family preservation and why we focus on it. And one of the biggest gaps in justice and equity that people may never have heard about, and definitely can impact perinatal outcomes, is Black family separation and what people call child welfare. Many of us in the space believe that's a benevolent term that does not actually adequately convey what the system actually does in terms of policing families and not providing adequate support. The system, it's many people's experience that it's centered around conditioning support, on surveillance and punishment. And in fact, nationally, 3 out of 4 of cases of child abuse and neglect really relate to poverty. And the vast majority, as high as 90% in DC, are actually neglect versus abuse cases. But rather than address poverty, the government punishes parents. And during a sort of perinatal period there's a particular vulnerability for involvement by CPS agencies. But again, these systems are structured around what, really have been centuries of domination that seek to really control and police Black mothers' parenting and reproductive choices, and especially those of low-income Black women. And as we know, historically, these practices are rooted in what was the propagation of, Black women's labor for capitalist ends. And again, the system really seeks to punish rather then lend a helping hand. And we really work to oppose that by building power and support for families through those mechanisms that, I've described. And, our work, we talk a lot about poverty and how it can impact maternal and other health outcomes, because we know 80 to 90% of health outcomes really are shaped by social determinants of health, poverty, opportunity, and I think by some estimates, it's only 10 to 20% of outcomes that are based on clinical factors. And so, I can go on, but we really, just try to focus on, addressing poverty, and specifically the system that is supposed to was originally rooted in, kind of a Social Security Act that was meant to actually support parents, but has become one that is punitive to them, particularly in their time of need. Children 0 to 3 comprise the largest percentage, at least here in DC, of kids who are identified by the system and then adopted out. So, this period, postnatal period, is particularly important, and where parents are particularly vulnerable to surveillance that begins with sort of mandated, reporters and hospital systems who we're trying to educate, and onward. So in any event, those are, sort of some of the connections between, our focus on poverty, family preservation, and perinatal outcomes.
Thanks for digging deeper into that term to educate us, Melody. And I also appreciate your emphasis on systems, right? Which are just so critical. And in 2024, I just think we really can't afford to talk about any crises, but particularly any involving Black and Brown folks, where we don't name those intersections and where we don't spotlight systems, because everything else just feels like a circular conversation, right? And so to that end, this is for both of you, but I'd like to keep some of the thread of what you were discussing about reform, Melody, in your piece, and ask a question about advocacy for reproductive justice and birth equity. What are some of the policy reforms or legislative actions you believe are essential to addressing some of the challenges that you just named? And I'll throw in there that, perception is that word popped into my mind while you were talking, Melody. Just the whole what was it, neglect, right? As being defined by folks who don't have a real understanding of what it means to be a parent on the poverty line and what's required. So can you talk a little bit about or highlight some of the policy reforms and legislative actions that you want the folks who have joined us to be aware of?
Absolutely. And so, and again, we've touched on this a little bit, but, values that frame our policies, as you mentioned, assumptions people make, narrative, all of that informs, and, the policies historically are really important to name when we talk about solutions, because they've been, intentionally embedded and, racially discriminatory policies. And that's what we're really trying to transform and reimagine. And so, we have to think about like cash supports and how historically, we've built some public cash support systems that excluded Black women intentionally. The widows' pensions that were intended to support women who did not have sort of a partner, and those were denied to Black women historically. Cash welfare, has transformed over, decades. It historically excluded Black women There was just like, workforce and systems, even after Reconstruction, really re-enslaved, Black people. We all know, I think about chain gangs as I continue my study, learning about how Black women were pressed into domestic service. Again, this is post-Reconstruction, and even children into apprenticeship. So I think a lot about our economic, kind of policies, our workforce development policies, and just thinking about some of those and what we can do. As you named, barriers of medical racism and bias, and this is the great work Jade is doing, providing access to care and providers who look like and understand and are empathetic, with Black women and Black and brown women and those who experience highest levels of negative maternal outcomes and maternal deaths. There's again this inadequate social safety net, which again is intentional, again historically exclusionary, and it's important that we recognize the role of history because many of the roots of these programs are still, there. And so, we are working specifically on promoting guaranteed income here in Washington, D.C. And that's, kind of a movement that's kind of grown up around the country. And, we are working to strengthen it and to avoid a lot of the bureaucratic hurdles. In particular, just to go back to the example of this system of, child protective system, many call family policing. What is happening in that context, as an example, is that for one child in Washington, D.C., the cash assistance payment is about $450 for the first child. And however, if that child is raised by a stranger, the stranger is provided by about $1,000 a child. So we see these like disparate and sort of negative economic policies across the board. So they really have to be addressed. Too many families live below the poverty line, and those families are the ones, headed by single women. I've got lots of numbers here in DC, like, more than a third of the women in DC who are single are, living in poverty. So, those are some, and there's a whole array of solutions that are proposed through the Momnibus, federal legislation, which address a number of different structural issues, technology, workforce, and and many others, housing. So those are some. But they're absolutely important to address to tackle the problem of access to care, and having adequate resources to address particularly like complicated pregnancies and other matters, and to prevent them in the first instance. So those are some that we've been working on and that are out there.
Thanks, Melody. Before I've got a question I'm really excited to ask you, Jade, about the integration of midwifery and doula services in our healthcare systems. But before we get to that, are there any policies you want to mention real quick?
I mean, +1 to everything that Melody just shared, especially when it comes to thinking about or talking about the Momnibus Act. One thing in particular that I would want to highlight, or just pull out, is when we're talking about increasing access to care, increasing, the provider workforce that looks like us, increasing access to midwifery care for the folks who qualify for that care, who would really benefit from that. Even outside of pregnancy, midwives are a really big benefit to communities because they can support you even outside of pregnancy. And a lot of folks don't know that. But when we're talking about increasing that provider workforce, we also need to remove the barriers to entry to that profession. There are a lot of different things that folks, who are hoping to become midwives, a lot of hurdles that they have to jump through in order to become midwives and become, community providers. And if we're able to remove some of those barriers, whether they be financial, whether they be, some midwives already have children of their own and needing the financial support when it comes to taking care of their household in order to continue their education to become a midwife, that's something else that we also need to really make sure that we're doubling down on. Like, we can't just say that we want folks to be able to go see midwives. Like, I would love that, that would be a dream come true. And if the provider workforce is not actually there, if we don't actually have folks trained, then they're just beautiful words on a piece of paper. So how are we actually removing the barriers to entry and education for these different roles of midwife, for the different roles of doula, lactation consultant, IBCLC, because these are also other roles that folks can enter into to support their own communities. So outside of that, another thing I've been thinking about when it comes to system reforms and policies, capitalism has a real chokehold on a lot of different things, and the payer systems and insurance systems
Yes.
is another one where the hands are deeply entrenched. And so if we're thinking about how we can better support folks and building relationships and building care with trusted providers and giving providers time to build those relationships as well. Another thing I think we, need to continue to think about and push for when we're thinking about reform is reformatting these payer systems so that, providers and practices aren't dependent on the number of patients they can see in a day. Because that's how we get to the, 10 or 15-minute visits, which you can't really build a relationship in that amount of
Nope,
time.
you
You can't
cannot.
ask the questions in that amount of time. If you're feeling rushed, if you're feeling like a
Yep.
number. And so
It's
that's one.
stressful, Jade. It's
Oh,
stressful to
it's
be
so
in those
stressful.
conversations.
So stressful. And one of the things I, support my clients in thinking through is identifying questions, concerns, whatever they might have ahead of the meeting so that they have a game plan when they go into those meetings. Because we know we got 10, maybe 10 minutes, sometimes 15. Especially if we're not working with someone who is a midwife who has the time and has built it into their practice to sit with you for an hour, to be in community with you, to have tea with you. Like, if we are, and just being very realistic, not a lot of folks can afford to access midwifery services. So until the time where we can completely overhaul these things, how can I support folks and kind of working within the system, maximizing, the opportunity that they have in front of their provider, sometimes even demanding that the provider stay there for all 10 minutes. Because if I got you for 10 minutes, I want all 10 minutes because I have questions. How can we, for the time being, work within those systems as we continue to try and change what it looks like? And then, not necessarily policy reform, but something that I'm seeing a lot of is providing scholarships or sponsorships for folks to be able to access midwifery and doula care. I think that's another big thing that, we can continue to have conversations about.
My colleagues, Chica, Abriana, and I were in a discussion yesterday about how DC is actually pretty resource rich when it comes to prenatal care, when it comes to options, but the barriers to access.
Yep.
Right. So, folks don't have the information, and once they have the information, Jay, to your point, can they actually access it or access it consistently?
Exactly.
So I don't know which is more frustrating, like being in a desert, for lack of a better phrase, or where you're someplace that doesn't have any resources, or being in a resource rich place and not accessing what's available to you, because
Yeah.
half the time you don't even know that you're eligible or that you can seek assistance for those services. So thank you for that. And I said I was excited about asking for examples, anecdotes, stories where the integration you just referenced has worked, right? Where you as a doula yourself, or doulas and midwives have been able to work alongside folks in traditional healthcare spaces. And this has been top of mind for me for the last couple of weeks, but because the Greater Washington Community Foundation made it possible for me to see a viewing of Abby Phillips' documentary on CNN called Home Birth Journey.
Mhm.
saving Black moms. And one of the highlights of that documentary for me were the examples of folks, I believe, in the LA area who were devoting significant resources within a hospital system to transform, and you referenced this, I think both of you referenced this, to just transform the way that birthing is done um, in that institution. And that includes incorporating midwifery and doulas and really focusing on the health, well-being, joy of the mom and transforming what has been a traumatic experience for so many Black mothers into what it should be. I've already lost the translation that you said earlier. I don't know if it was bringing the light or
Oh, to give the light. Yeah.
to give the light, right? Like it is a literally a life-changing, right, and community changing event. And it often is something filled with dread for, right, for many moms. And so I loved that the documentary kind of focused in on what is working. And so that was in a West Coast context. What do you know based on, what you've seen happening closer to home here?
Yeah, so I'll actually backtrack and say in 2015, I took my very first, very, very, very first doula training. And I was actually out on the West Coast, and that is when I first learned about integrated models. I was at UC San Diego. They had a volunteer doula program at their in their hospital system. And so this is a doula training other folks who want to be volunteer doulas for this hospital system. And, we did like 2 or 3 days. We talked about all the tenets of being a doula, what it would actually consist of. And then we took a tour. So they had the, typical labor and delivery floor, and then they had a birth center floor. And it blew my mind. I said, everybody needs to know about this. Why aren't more people doing this? Like, what is happening? Um, and just being so blown away. Again, that's on the West Coast. And so when I moved back to the East Coast and saw that there are birth centers, standalone birth centers that, are in this area, in this immediate area, and we have 1 or 2 hospitals that have integrated midwives into practices with physicians. And so they are, not only collaborating and participating as part of a care team, but they're also learning from each other. So providers or doctors are learning from midwives, and how that sometimes shows up. And it might seem very small, unless you're in the industry, or, unless this is your everyday. But how that sometimes shows up is you don't get that sense of urgency or rush from a provider of like, we have to get you out of here. You have to give birth by the end of today. Pending that there's no emergency or anything like that. Like, and it can be such a breath of fresh air. They come in, they check on you, they sit with you, they ask you the questions, and then, they said, all right, you're doing a great job, and we're going to keep going. And I see you've got your doula here, and, your nurse is coming in to check on you every so often. And I'm not concerned. You have any questions? Like, let's talk about some things. And so it really does change. It changes the air that you're having to breathe. Each hospital has their own birth culture. And what I've noticed with the ones who have integrated midwifery care have really close relationships with midwives, because maybe it's not a complete integration, but they have relationships with community midwives, or, midwives who are part of the community, maybe not attached to a hospital system. It changes the air. It really does. And then speaking of that, relationship between midwives and doctors, when a midwife is not a part of the team, if there is that relationship, in the moments where we need to do a home birth transfer or a birth center transfer, there is less shame, there's less judgment. Like the folks going into the hospital system after, identifying that actually the progress of labor has taken a turn and the safe route to go would be to now transition to a hospital, there is less that they are, I won't say less that they're worried about, but that is like, that's not a part of the mix at this point in time.
Yep.
Because I know I can go in here, I'm going to get the care that I need. My midwife has talked to this doctor.
Yep.
I feel safe. I know my midwife trusts this person. They trust the staff. That's why they're sending me here. And so even the handoff relationships, it can be a warm handoff, and folks still feel taken care of. And regardless of where they're going, that's what we want people to walk through these journeys feeling. I want you to feel held. I want you to feel seen. I want you to feel heard. And that's with everybody that's on the team, whether it is your doctor that you had to transition to, your midwife that you usually get care from, your therapist, if you have a, relationship with a behavioral health professional, whatever it might be, all of us working to support you and your family. Like that is what the true integration means. And like I said, whether it's, fully integrated into the hospital, which I would love to see that everywhere, hopefully we're driving towards that, or at least having doctors and midwives that are in the community building these strong relationships so that we can do the handoffs and it's not having to move in secret or whatever else that might add to the stigma and shame and also impacts a person's experience. Like
Yeah.
we talk a lot about the physical, but if we're thinking of a true holistic model and taking care of the whole person, we also need to think about the emotional impact that going through such a big transition can have on somebody and like whether or not they're feeling taken care of. And yeah, I could go on for days. I could go on for days, but yeah.
One of my biggest takeaways well, there are a couple, but the air that I'm holding on to that, right? It's so important, something so simple, but what's the air, what's the vibe, what is the mood in the various spaces that expectant moms or folks who are delivering, and that also includes, which is a nice transition to a question I have for you, Melody, the space that they're going home to.
Mm-hmm.
Right? So if you have managed to if you've managed to cultivate a space prior to and during delivery that is healthy, that is joy-filled, that is trusting, but you are transitioning home in a matter of days if you end up in a birthing center or a hospital that is what we might characterize as unstable or mired in crisis. How can you be expected to bring your best self to this new stage, whether you're a first-time mom, parent, or not? And you spoke a few times, Jade, about the postpartum period. And my question is for you, Melody, regarding the importance of the additional stressors like housing insecurity, right? Like underemployment, which is directly related to childcare concerns, right? All these broader social issues and determinants. Can you talk about ways that we should feel more responsible for creating a supportive environment for moms regarding their mental well-being, which is impacted by all of those things? And one of the things I haven't brought up in this none of us have, is safety, not just within the home, but safety in your community, right? Like, can you take your baby out for a walk? I feel like you're gonna make it back in one piece.
Yeah. So, what came to mind during Jay's last comments and now your question is just how critical trust really is. And in that postpartum period, who is there for you, after, you've given birth, when you need so many things done and assistance with so much, particularly if you have younger children whose needs aren't met and you're single parent, single mom. And unfortunately, and we've seen this happen too often, the moms just don't have trust in the services that are offered to them because they're coming, again, the structural issue of, at least in DC, government supported home visiting programs come with strings. They're kind of embedded in these sort of, child protective services agencies, which means that, there's restrictive mandated reporting. And so advocacy around mandated reporting is so critical because there are women who just won't accept help because they think it invites the government, in an unhelpful, intrusive way that actually might result in them losing a child. So, and then what they hear are stories from friends and others who might say, I had a slip up here and there with a new baby, and all of a sudden, they're at risk for losing their child. So I think the trust factor is incredibly important. And so we really need to focus on, providing them with that critical support, doula services before and after, where they're not feeling that they're, they might lose their children. So, in terms of, safe housing, absolutely, the women we work with, and this is of course important, all the time, but particularly during the prenatal period and when there's, an infant, having a house free of mold. I mean, that is one of the biggest problems we hear about, like environmental pollutants, that inside the home and outside the home. And so, these are absolutely critical, and absolutely people having a fear of, doing what would be healthy and beneficial to the new mom, for example, and the baby, walking around their neighborhood, like feeling that, they can do that. Many of us take that for granted, sitting in a park, with a new baby. I can remember that, like, you keep the new baby, away from like a bunch of strangers, but you want to have some time to, to kind of be outdoors and out of your home. And if your neighborhood park just doesn't feel safe, I mean, the mental health, kind of implications of that are, just tremendous. There's also, in our experience, unfortunately, I keep going back to this issue of, our policing, family policing systems, that we have, wonderful leader in our community who has, had the horrible experience of suffering postpartum depression, and then coming to the attention of the agency, who determined that there was no way to help her and that they actually removed her child, and she fought successfully for that child. But it took a year. So, I think we really need to think about like the systems of delivery of these supports. And I, don't have numbers on this, but I am sure that there are many mothers who reject this much needed support for fear that they will, in fact, lose their children or come within, what's really a surveillance system. So, those are just some additional considerations, I think, when we think about like policy and, kind of related policies that must be explored and addressed.
Thanks for that, Melody. The last piece that you were talking about just reminded me that in my kind of introduction to the nationwide maternal health crisis, which is, disproportionate for this area, we've spoken a lot about underserved women and families. And just taking it back to one of the first things we talked about so much of this being systemic issues that actually impact so-called middle class women, however that's defined in 2024. So much more ambiguous now than it was 20, 30 years ago. And high income women, right? I go back to the Abby Phillips documentary, Abby Phillip, put an S on the end of her name, documentary, where she reminded me about Serena Williams, right? Mm-hmm. And so we have it named anti-Black racism and how its pernicious presence within systems make it difficult regardless
Right.
of your level of education, your economic background. Obviously, folks in women in our underserved communities suffer the brunt, but up and down the income spectrum, uh, safely delivering, like having respectful, productive relationships with the healthcare system,
Yep.
safely engaging
Mhm.
during your delivery, right? And then the postpartum care that you receive, all of that is impacted by systems that have not bothered to retrain, right? To reframe how they engage with women of color and Black women in particular. Um, and our women, our moms, our birthing folks, are dying as a result. And so when you layer on top of that all the other things we've been talking about, I really appreciate having some specific policies that you all have talked about, things that as a community we can impart to the women and birthing people in our lives who, word of mouth works too in
Yeah.
terms of helping folks access resources. It's actually still really important. And I want to name a bias of mine that is probably related to my stage of life, Jade, which is that I rarely think about teen moms. And as we transition to Q&A, I would really appreciate you spending just a little bit of time talking about the importance of supporting that group of moms and birthing people and talking about what some of their particular needs are.
Yeah. Whew. So what I'll start by saying is, even though I was in sex ed, loved teaching it, I also had my own biases. And I was there. I was like, I'm here to save the babies. I'm here to stop them from making these awful decisions. And, we can't, young people can't be getting pregnant, all of those things. And I'm sitting in sex ed spaces. And it wasn't until I actually had the time to sit and talk with my young people and like treat them as the autonomous human beings that they are and hear their stories, hear their hopes, hear their fears, hear how they were thinking through decisions that I was like, oh, Jade, you can't be anybody's savior. And that's the same type of mentality that you have to have as a doula, like plot twist for anybody who's thinking about becoming a doula. Coming into this with a savior complex is not going to serve you well. So after removing that savior complex, after removing that hat, realizing that a lot of young folks want the same things that we want, the older that we get. We want to be loved. We want to be seen as the functioning human beings that we are. We want to be respected. Like, yes, I've made this decision and I am still my body, my mind, my heart are still transitioning through this very big thing. And I need support. So just like, someone who's in their 20s and 30s, even 40s might need cash support, so do they. Just like someone who is older might need, help with thinking through how to approach a provider visit, how to pick a provider, which intervention, if any, they might like to utilize throughout their birth process. They need the same thing. They also need the education. They need the amplification of their voice. They need to, you know, they need to be held so that they can tap into their own power. Becoming a parent is a very powerful thing. We even have a specific word for it when it comes to becoming a mother. It's called matrescence. It's a very powerful process, and they're going through the same thing. Of course, the prefrontal cortex and all the adolescent development stuff is still going on, but they still need to be held in the same way that, our older mothers do. So the education, the advocacy, the amplification, the celebration,
Yes.
also important for them
Yep.
because they are still going through a very emotional ground shifting process, just like anybody else. I had other points, but yeah, like when it comes to navigating relationships, navigating communication, learning how to advocate, they need all of the same things. And even more so because of not only the anti-Black bias that is steeped into the system, but also the ageist bias that is steeped
Yes.
into the system.
Yeah.
Um, you know, the paternalism that happens, it's embedded in general. I'm sure, you know, folks can attest to some of their own experiences, especially, you know, sometimes Black folks look a little bit younger and providers might talk to you a certain way because they don't expect you to be your age. And so the same thing really happens with our younger parents as well. But they, you know, need the same help making decisions and everything else, just like anybody else would.
Melody grounded us in some history, and you've both, you know, referenced the evolution of our communities, and I feel, I guess, sad is the leading emotion that the teen moms, younger moms who would have been embraced by communities that were more centralized, you know,
Mhm.
even, I don't know, 15, 20 years
Mhm.
ago. Um, it's just, it's a, in many cases, the landscape looks different.
Mhm.
And so the values that you referenced, Melody, that make it difficult for, you know, older or more mature moms and birthing people to navigate the system are three, fourfold um, for our younger moms, and they deserve better. And so thank you, Jade, for taking the time to talk about your own bias that you brought to the work, and having to push through that. I think all of us could probably stand to spend a little more time in self-reflection, right? Like what does that what would that look like, and what gift would that be?
Right.
Um, to our younger girls, our teens. I mean, and even the judgment associated with somebody who's in their early 20s, because the average age has shifted in such a way. Um, yeah, and that, I mean, that, I think that can start, that's self-work we can all do. And motherhood, whether you're 45 or 15, is one of the hardest things
The hardest things.
Absolutely.
to navigate. So,
Yes.
as much as possible, it should absolutely be a judgment-free zone, and that includes, again, those healthcare spaces where we could have a whole conversation about the ridiculous questions I was asked as, I'll just say, a more mature mom in age when we had our daughter, when
Mhm.
I would go on visits, and, you know, even was admitted when I got sick when I was pregnant. And the only reason that whole process turned out okay is because I happened to know uh, the president of the hospital, because I went to college with him. And I think about that often. Like, what would navigating that personal crisis have been if that one thing had been different for me? Um, so I'm looking at the time. This is one of those things I think we could all talk about for quite some time. And we don't have any questions. I don't feel bad about that, because I feel like our conversation has been, we covered a lot of ground.
We did. We did. And
In
could still keep going. That's the
and
thing.
we really could, we could still keep going, but I want to respect, I want to respect your time. I also want to send good energy and light to Dr. Lightfoot's patient. I
Mm,
hope all is going well there. I want to say how much I appreciate both of you, and how enlightening it was to have two experts doing two distinct things that still have plenty of intersections in this conversation. I'm grateful to both of you for that. And I'll bring our conversation to a close, and just say, that, as always, those of you who joined, please spread the word that this was recorded and will be available, because Sarah Weatherby is fantastic, within the next week for folks to watch and rewatch. Jade and Melody, I encourage you to push it out to your networks, primarily so folks can learn and refer to some of the resources and policy and advocacy opportunities that you all talked about. And finally, just a plug for the Women's Foundation. We are always on the cutting edge of supporting women and girls in this region, because to date, we're the only women's foundation that is dedicated to supporting women and girls of color. And we want that to change. But in the meantime, we're in this space by ourselves, and we need your support. And we are expanding our focus. Currently have a landscape analysis happening because we want to push into the birth equity funding space. And so we wanted to be good partners and find out what's being done well and where there are gaps, so we can fill those gaps and be additive rather than duplicative. So your contributions to our work in general will help us get closer to being able to do that, and supporting the sole practitioners, supporting nonprofits, supporting institutions. So please make your contributions to our efforts at the womensfoundation.org. Once again, thank you to our panelists, to those of you who joined us today, and we look forward to having you at next month's session. Take care, everybody.
Okay.